Hi, everyone. Welcome to my presentation on medical marijuana and Tourette syndrome. My name is Amber Shower. Obviously, I'm a pharmacy student and I'm in this class this semester. The objectives for my presentation are to recall the benefits of medical marijuana, discover how medical marijuana can affect a patient with Tourette syndrome, and explain the current treatments for Tourette syndrome. First, what is Tourette syndrome? Gilles de la Tourette syndrome, or better known as Tourette syndrome, is a disease that is diagnosed by having multiple motor and at least one phonic tic that lasts more than a year. For this disorder, behavioral therapy is first line, and after this, different drugs will be used to try and treat the symptoms. Many people with Tourette syndrome can experience an impaired quality of life because of things such as social isolation. Many people with Tourette syndrome have also experienced other behavioral problems such as ADHD and OCD. Current treatments for Tourette syndrome are usually just to try and control and lessen tics that are interfering with everyday life. The first medication that they commonly use is a dopamine block or dopamine antagonist, such as haloperidol, risperidone, or pimozide. And then they also can do Botox injections. I had to read up a little more on this one, but pretty much what they do is wherever someone is experiencing that tic, if it's a specific muscle, then they inject the Botox into that. And it's usually just for simple tics, but the Botox can also be used for vocal tics. And then they use ADHD medication. Like I had stated in the past slide, many people who suffer from Tourette's syndrome also have a higher chance of having ADHD. Sometimes this ADHD medication can help with concentration, but sometimes people may experience an exacerbation of the tics, so it doesn't really help them. There are also central adrenergic inhibitors such as clonidine and guanfacine. These are shown to just calm down the tics in general. And then antidepressants, like I said before, many patients with Tourette syndrome can also suffer from anxiety and OCD. So, a common antidepressant used in Tourette's is fluoxetine. And then they have used topiramate, which is an anti-seizure medication, to help lessen and control tics. Continued on current treatment, therapy is also recommended for patients with Tourette syndrome because of social anxiety and them having to deal with their tics out in public. First line therapy for Tourette's is behavioral therapy, though. They try and do habit reversal training, which kind of helps them to identify their motor tics and identify the urges that they have before they get a tic, and then learn to voluntarily move in a way that will not allow them to do that tic. There's also psychotherapy, which this helps along with the regular therapy for the problems that they can be experiencing, such as ADHD, OCD, anxiety, and depression. And then there was a talk on the mayoclinic.org about deep brain stimulation. It's a device, it's a battery operated device, and they implant it into brain and then it delivers an electrical shock. More research is needed on this, and I couldn't really find a lot of information about it. So, my first article was Medical Marijuana, a Treatment Worth Trying. Medical marijuana, they talked about how this can help to alleviate many symptoms in many different conditions, which we've been learning about this whole semester. But the most common symptom that it's used to treat is pain. Many patients with Tourette's syndrome can also be suffering from pain because of motor tics. They can get very weak muscles, like fatigue muscles. This can also help with nausea and vomiting in patients that receive from or chemotherapy. It helps patients to gain weight which have suffered from HIV, bulimia, or any eating disorders. And there's also many other conditions that medical marijuana may help with, but we're going to talk about tics in Tourette syndrome. And then in this article, they did state that the only time that you really want to recommend medical marijuana is after all of the standard medications, FDA approved cannabinoids, and non pharmaceutical approaches have been exhausted. So, this next article was a single centered experience. They had 42 patients in this, and overall, the patients were asked to rank their satisfaction of medical cannabis based on the alleviation of their tics. They used the medical cannabis in a dose of 20 milligrams by either an oil or an inhalation. They didn't specify if it was specifically a vape inhalation or a flower or bud inhalation. But overall, these patients said that their experience out of 5 was a 3.8, their alleviation of symptoms. So that was good because it was a 77% satisfaction. And then about 75 patients elected to continue the use of medical cannabis even after this study had finished. They didn't state that there was any worsening of their OCD, and the most common side effects that they had seen were tiredness and dizziness. My next article was Delta 9 THC and dopamine receptor antagonists. The dopamine receptor antagonists, or also called the neuroleptics, they've been seen to have the most effect on the tics as far as relief goes. In this trial, they had demonstrated that the Delta 9 THC, it alone produces a tic suppressing effect, and it helps to alleviate both motor and vocal tics. But then combined with the neuroleptic drugs, it can cause an increase in hypokinesis, which is the decrease of muscle movement. So it is allowing the patients to reduce the motor movement. In this study, they seen that risperidone and amisulpride, which is a very common dopamine receptor antagonist, when they were combined with Delta 9 THC, it was shown to have the most benefit for the relief of the tics. So my take-home points, medical marijuana has many medical benefits for a range of different conditions. It can be used and has many benefits in Tourette's syndrome, not only to alleviate tics, but also to alleviate stress and anxiety in patients. And the alleviation of tics and Tourette syndrome has been shown with both monotherapy and combined therapy. Those were my references. Thank you.